Okay, this is the medical presentation on concussions and CTE by Hannah Black. So first off, what is a concussion? A concussion is caused by a TBI or traumatic brain injury. A TBI can be from a bump, bolt, or blow to the head that causes the brain to move back and forth rapidly. An MRI or CT scan can be used to detect bruising or bleeding in the brain. However, only a neurological exam can be used to confirm a concussion diagnosis. Based on symptoms, concussions are graded on a scale of mild, moderate, and severe TBIs. Here is a little video of what a concussion is, what it looks like inside the skull.
Traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers. A concussion is a type of traumatic brain injury.
Okay, a little information about the brain. You have your right and left side of the brain. So the right side of the brain is responsible for the creativity, emotion, feelings, artistic abilities, and the left side is more logic, analysis, and facts memorization. And the brain is surrounded by cerebral spinal fluid, or CSF, to protect the brain from damage. So your brain's kind of floating around in your skull within this fluid to prevent it from hitting the skull walls constantly. And that's what a concussion is. It's caused by the brain hitting the walls of the skull. A traumatic brain injury can cause bruising or contusion, as well as swelling of the brain due to that trauma. The brain directs all movement and information processing, and it is the most fragile organ of the body. So part of the brain is the neurons, and neurons receive and send electrical signals to and from the body. Neurons are composed of the cell body, axon, and dendrites. There's a few other pieces to that, but for this presentation, we're going to be focusing on those three. So the dendrites, you can see, are those little branches off of this cell body, and they receive messages from other nerve cells. And the axon, as you can see on the other side of that cell body, the axon connects the neurons with each other, providing connections to other areas of the brain. So neurons share information with each other through those axon and dendrites. So coup or counter-coup injury is the brain hitting the skull. It's that movement. Coup is the forward movement, counter-coup is the backward movement, and those two together, back and forth in a fast motion, will cause a concussion, causing the brain to hit the skull. The axons can experience shearing forces, tearing it from the cell body. That's called axonal shearing or axonal shearing injury. This can cause brain damage, can either continue on for hours or even days after the injury. Severed axons can cause a cutoff of communication through the brain. And torn axons degenerate, meaning they die, releasing toxins and chemicals into the extracellular space, which can cause even more neurons to die. And that chemical imbalance, chemical change, can even cause depression. Symptoms of this include memory loss, loss of consciousness, reduced problem solving, and attention problems. And if you have severe brain damage from those axonal shears, you can even end up in a coma or vegetative state. So some signs and symptoms of concussions. This is what doctors and nurses will use to assess how severe a concussion is. So the headache, migraines, and pressure on the head, nausea or vomiting, dizziness and impaired balance, photosensitivity, so sensitivity to light, having too much sunlight, being outside, that light on your eyes, or even a TV or phone screen, that blue light can cause headaches or migraines, noise sensitivity, feeling sluggish or groggy, brain fog, which is kind of like not feeling fully awake, kind of similar to feeling sluggish and groggy, confusion and memory loss, as well as depression, anxiety, or mood changes. And it can even lead from the movement of the head going back and forth so fast can cause whiplash or cervical pain. Some tests that are done for concussions are neurological exams and cognitive testing. So neurological exams include strength, reflexes, coordination, balance, hearing, sensation, mental status, and eye exams. And then the cognitive testing includes memory, recallability, and concentration. So one they'll do a lot is the recallability. They'll ask you to remember 3 words at the beginning of the assessment, and then by the end of the assessment, they will ask you again if you recall those 3 words, and that assesses your recallability. So for nursing assessments specifically, the assessment is very important for making an individualized plan of care for patients. This will include health history, overall health, and including some family history, history of migraines or previous head injuries that can contribute to more damage to the brain. And migraines, if you have a history of migraines, that can cause a concussion to be more severe compared to someone who does not have chronic migraines. An incident report. So how the concussion occurred, what was the accident that went on, what was the patient doing? Loss of consciousness. If they lost consciousness, and about how long. Do they remember what happened right before they lost consciousness? What do they remember coming back to consciousness? The symptoms the patient's feeling, and pain scale. So a neurological exam, part of the head-to-toe assessment, the neurological part is very important to assess the cranial nerves, strength, and reflexes. And eye exam as well, so you want to check for perla, ocular movement, make sure that's intact, as well as convergence, because a concussion can affect your vision and hearing. And lastly, you want to assess the mood and emotional state. So from that brain hitting the skull walls, that causes a chemical change in those axons degenerating, releases those toxins into the extracellular fluid, and that imbalance can cause mood and behavior changes. So concussion treatment, there's not really any medication treatments for concussions, for the concussion itself, besides the symptoms patients may have, but rest and sleep is the biggest. The best way for your brain to recover is when you're in the sleeping state. Not reading for long periods of time, so doctors and nurses might recommend that you limit studying time, limit reading if you like to read for fun. That just puts a lot of strain and stress on your eyes that will prolong the healing process of the brain, as well as limiting phone and TV use. That blue light is not good for your brain. No sports or activities. The last thing you want to do is go back to a sport, go back to your high intense workout and activities before your brain is fully healed. That puts you at risk for prolonged healing and for a second concussion or brain injury. A lot of doctors might recommend at least 1 week of no school and no work. They can usually write you a note for school and work, but you want that minimum week of taking that rest and recovery. So both physical and mental rest is important. And some medications that they may recommend is just ibuprofen, Tylenol, Excedrin, maybe Ubrelvy. Those are some migraine medications that may help. Muscle relaxers if you have that whiplash and cervical pain in your neck, and then other pain meds as well. So now we're going to talk about CTE. CTE is chronic traumatic encephalopathy. That's a brain disorder caused by multiple head injuries. Degeneration is the death of nerve cells in the brain and worsens over time. So CTE can cause loss of brain cells, and they will not regenerate. So some symptoms of CTE include memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, anxiety, suicidality, and eventually progressive dementia. So a lot of these symptoms are similar to concussions, and as well as dementia and Alzheimer's. So this can also cause some physical limitations or impairments. Like we mentioned earlier in the neuro assessment, you want to assess strength, make sure it's equal on both sides. And because CTE concussions can contribute to neurodegenerative diseases like Parkinson's, and a high percentage of football players are diagnosed with CTE. So we'll get into the diagnosis on the next slide, but a lot of players are found to have CTE. That is the number one risk factor for concussions. And a study from Boston University found that 91.7% of all football players studied were diagnosed with CTE or had the symptoms of CTE. And they actually did another study where they had 100 donated brains, and out of the 100 brains, one of them was confirmed diagnosed with CTE, and that one brain that had a confirmed diagnosis of CTE was the only donated brain of a deceased person who had played football. So how is CTE diagnosed? CTE can only be confirmed after death through a brain tissue analysis. So you see on that left side, you have your big, normal, healthy brain, and on the right side, advanced CTE. So you could see this on a CT scan, see the size difference of the brain, but the only way to confirm that CTE was the cause of death is through a tissue analysis. And they'll take that brain tissue, put it under a microscope, and confirm that diagnosis. CTE is not reversible or curable. So all that missing brain matter on the right side of the advanced CTE brain, that cannot be regenerated. Risk for CTE, they found multiple concussions, head injuries, contact sports such as football, boxing, wrestling, military veterans, and intentional harm done to domestic violence and abuse victims. Not all head injuries will lead to CTE, but is definitely a risk factor and will increase the chance of developing this. So how do we protect our brain? Number one, protective gear. You want to wear helmets during football, since football is the number one risk or the most common population for concussions and CTE. Techniques to avoid blows to the head. So maybe directing blows to other parts of the body, not ramming into people with your head straight on, and limit the amount of contact during sports practice. It's already dangerous enough during games, and we want to limit that amount of head first contact during practice. The 3 R's for concussion, an article found that 3 R's, easy to remember: recognize, report, recover. Number one, recognize. You want to recognize that you have a head injury, that something's not right. Then you need to report it. Report to parents, report to doctors, report to coaches, teachers, professors. Let them know of your symptoms, what you remember from the accident, and then recover. Rest and sleep is very good for recovering. Following the recommendation of doctors, or if you see a concussion specialist or neurologist, and driving safely and wearing a seatbelt. That can definitely help protect your head and your whole body from accidents. How do we strengthen our brain? Diet and exercise is very important. You want to live an overall healthy lifestyle. Some brain food includes nuts, seeds, salmon, blueberries, dark leafy greens, lean red meat, avocados, tomatoes, whole grains, brown rice, dark chocolate, and quinoa. These are just some of the brain foods that are good for you. There's a lot more, but these are the big ones. Get plenty of sleep. Like we said, sleep is good for your brain, helps your brain recover. Remain socially involved. Take care of your mental health. Having a good support group and having people you can go to and talk to for support is very important for physical and mental well-being. Limiting caffeine intake and other stimulants. So, 5 shots of espresso every day is not going to be good for your brain. It's not going to stimulate your brain, keep it awake, and preventing it from getting that rest and that sleep state. Reading, studying, and playing games is good to improve your memory and cognition. Limiting alcohol intake. Alcohol kills your brain cells, can kill brain neurons, and like we mentioned earlier, those cannot be regenerated, so protect your brain. Mental health. For patients, mental health can be affected for even just mild TBIs and concussions. So the death of neurons can cause that chemical imbalance in the brain, which can lead to further brain damage and depression or mood changes. And also, not being able to go to school, work, or sports can cause patients to feel isolated, separated from their normal routine, can get them feeling down or depressed. Yeah, so having a consistent support system is crucial for that recovery. If severe depression occurs from a concussion, antidepressants and anti-anxiety pharmacological interventions can be used, but they will only if non-pharmacological interventions are not effective. So we have some more questions. What are the 3 parts of the neuron that we mentioned? The answer is the axon, cell body, and dendrite. There was a few more of those, but those were the 3 that we focused on. What does CSF stand for and what is its purpose? Cerebral spinal fluid, and that protects your brain from damage and hitting the skull wall. True or false, a CTE can be diagnosed using a neurological exam while a person is alive. This is false. A CTE can only be diagnosed after death by a tissue analysis. Remember, you can see the shrinkage of the brain with like a CT or MRI. You can see the size of the brain, but the CTE can only be confirmed by that tissue analysis. Question 4, true or false? Degeneration is brain cells recovering, rebuilding themselves. That is false. Degeneration is the brain cells dying. Question 5, true or false? Caffeine is a stimulant. And this one is true. Caffeine is a stimulant that will keep your brain awake, preventing it from resting in that sleep state. And this concludes the presentation. Thank you.